Hello guys and welcome back to our channel CMS Prep. Today in this video we are going to discuss all the questions related to family planning and contraception asked in UPSC CMS from 2009 till 2024. We have about 16 questions, so let us begin. Question number 1. Consider the following statements regarding LNG-20, that is Mirena. It is a T-shaped IUD filled with natural hormone progesterone. So it is wrong. It contains synthetic hormone levonorgestrel, not natural progesterone. So this statement is wrong. It is associated with low pregnancy rate, 0.2 per 1000 women. Yes, it is correct. Statement 3. It is associated with large number of ectopic pregnancy. It is wrong again. In fact, LNG is associated with reduced ectopic pregnancy risk compared to no contraception. Statement 4. It is associated with lower menstrual losses compared to copper IUD. Yes, it is correct because it thins the endometrium. Therefore, the blood loss is less as compared to copper containing IUDs. So the correct option is B, 2 and 4. Mirena is a third generation intrauterine device. What are the advantages of its use? Option 1. Low uterine pregnancy rates. Yes, it is correct. It reduces the pregnancy rates as it is used for contraception. Prevents anemia. Yes, by thinning out the endometrium it decreases the blood loss, hence reducing anemia. Now option 3 and 4. In the official answer key, 1, 2 and 3 is given as the correct option, but both of these options are incorrect. Why? Because a long effective life of 10 years, it is incorrect. The life of LNG-20 or Mirena is 5 years and no effect on incidence of ectopic pregnancy. It is also incorrect because LNG actually reduces the incidence of ectopic pregnancy. Hence both of the statements are incorrect, but in the official answer key 1, 2 and 3 is marked as correct answer, hence we will go with this. So the correct option is A. Among the following intrauterine contraceptive devices, which of the following are included in second generation IUDs? So first generation IUDs uses plastic, inert plastic like Lippis loop. Second generation is copper containing IUDs, that is copper T200 or copper T380, copper 375, and third generation IUD is hormone containing IUDs, for example Progestasert and LNG-20. So out of these options, 2 and 4 belong to second generation IUD, hence option D is correct. Which of the following is not an absolute contraindication for insertion of intrauterine devices? So the absolute contraindication for IUDs can be remembered by a mnemonic, that is PIMBU. P stands for pregnancy, I for infection, M for malignancy, B for unexplained or excessive bleeding, and U for uterine abnormalities like fibroid. So out of this belongs to malignancy, so it is an absolute contraindication. Pelvic tuberculosis is an infection, hence it is also an contraindication, and puerperal sepsis is also an infection, hence absolute contraindication. Severe dysmenorrhea is a relative contraindication, not an absolute contraindication, hence option B is correct option. The contraindication for Progestasert include all of the following except. So pelvic inflammatory disease is a type of infection, hence contraindicated. Uterine fibroids is malformation in the cavity or cavity distortion, so IUD or like Progestasert is contraindicated. Previous history of ectopic pregnancy is also an contraindication for inserting Progestasert, but previous history of abortion is not an contraindication for inserting Progestasert IUD, hence the correct option is D. Which of the following is a third generation intrauterine device? So third generation intrauterine devices contain hormone containing IUD, that includes Progestasert and LNG-20, that is Mirena. All these three, copper 7, copper 200 and copper 380, are second generation IUD. So correct option is option D. Which one of the following IUD is associated with low pregnancy rate, 0.2 per 100, or less number of ectopic pregnancy and lower menstrual blood loss? Okay, so this is the classic description of LNG-20 or Mirena. Why other options are incorrect? So copper devices reduce the pregnancy but have increased bleeding risk, and Progestasert has higher failure rate than Mirena. So Mirena is the correct answer, that is it reduces the pregnancy risk. Along with that, it decreases the number of ectopic pregnancy and lowers the menstrual blood loss. So correct option is D. Copper T380 IUD should be replaced in. So for this there is a simple mnemonic. See, copper T200, the duration is 3 years. Multi-load 375, so 5 is coming, so the duration is 5 years. And for 380, so see here 0 is there, so the shelf life or it needs to be replaced after 10 years. Hence the correct option is D, 10 years. Which one of the following is defined as the average number of children that a woman would have if she were to pass through her reproductive years bearing children at the same rate as women now in each age group? So this is the classical description for total fertility rates. Let us discuss each option. First option, age specific fertility rate. So this is fertility at a specific age group per 1000 women, not the total lifetime fertility. So this is incorrect. General fertility rate is fertility for all women between the age group of 15 to 49, but again for a specific year, not for entire lifetime. Net reproductive rate. So net reproductive rate is total number of daughters that a newborn child will bear during her entire life, assuming the fixed specific fertility rate and age specific death rate. So this is also incorrect, but total fertility rate, it is the correct option, that total number of children a female will bear during her reproductive year, assuming the current age specific fertility rate. It is also the indicator of completed family size. So the correct option is D. The net reproduction rate of one can be achieved only if the following rate exceeds 60%. So first we need to understand the concept of CPR, that is couple protection rate. This is the total number of couple that are using contraception out of total number of target couple. If this CPR reaches to 60%, then the NRR will be 1. And this is NRR equals to 1 means it is the replacement level of fertility. So the correct option is D. TFR tells the birth per woman but not enough to stand alone stabilize population. Total marital fertility rate is specific to married women, again not alone enough. Age specific marital fertility rate is only per age group. So the real game changer is couple protection rate. It is the percentage of couple participating in contraception. If CPR crosses 60%, then the NRR can drop to 1. Therefore the correct option is D. In a population of 5000, there are 19% eligible couples. To achieve a couple protection rate of 60%, how many of these should be covered for family planning services? So 19% of 5000 is 950. So there are 950 eligible couple, and to cover couple protection rate of 60%, so 60% of 950 gives us 570. So 570 couples must be covered under family planning services to achieve a couple protection rate of 60%. Okay. Hormonal contraceptive are contraindicated. It is misprinted. Hormonal contraceptive are contraindicated in women with less than 25 years of age. No. Patients who are normotensive, it is not a contraindication. And patients who have anemia, it is also not a contraindication. In fact, it leads to decrease in anemia due to decreased blood loss. So the correct option is women who have thromboembolic disorder. OCP significantly increase the risk of thromboembolic events like stroke or clotting disorders in patients who have pre-existing thromboembolic disorders. Hence, hormonal contraceptive are contraindicated, and the correct option is C. What is the recommendation for use of levonorgestrel for the purpose of emergency contraception? See, levonorgestrel can be given in two ways. Either it can be given 1.5 mg stat, or it can be given 0.75 mg 2 times, that is 12 hours apart within 72 hours of unprotected intercourse. And no option is matching the description, so none of these. The correct dosing is 0.75 mg 2 dose 12 hours apart within 72 hours of unprotected intercourse, or 1.5 mg stat within 72 hours of unprotected intercourse. And none of these options are matching, hence correct option is D. Which of the following is an absolute contraindication for combined oral contraceptive pill? So diabetes mellitus is a relative contraindication, and unless it is complicated by an organ damage like vascular damage or retinopathy, it is not contraindicated. Migraine, so migraine is also a relative contraindication. Only migraine with aura is an absolute contraindication, otherwise it is relative. Previous history of thromboembolism, correct. Major absolute contraindication because estrogen increases the risk of clot formation. Gallbladder disease, generally caution is advised but not an absolute contraindication. Hence the correct option is C. Failure rate of contraceptive method is determined by half-life index. It is not even a recognized measure for contraceptive. Total fertility rate is a population measure, not a contraceptive failure measurement. Age specific fertility rate is same, not related to failure rate. Pearl index, so Pearl index is correct. Pearl index tells pregnancy per 100 women years of use, and it is used to measure the failure rate of various contraceptive. Hence the correct option is B. Which one of the following is an indicator for evaluation of impact of family planning? Family size, number of postpartum services availed, change in behavior of people, community need assessment. So the correct option is family size, because if you want to measure the impact of family planning, you don't only look at change in behavior. Family size reduction is the direct demographic outcome after years of family planning programs, and family size is considered a classic impact indicator, and change in behavior or change in behavior is more like a process or intermediate indicator, not a final impact. So the correct option is option A. Friends, with this we have covered all the 16 questions related to family planning and contraception asked in UPSC CMS PSM from 2009 till 2024. So if you like this video, kindly share, subscribe and comment. And if you want the PDF for this or you want to attend the live quiz, kindly visit our Telegram channel. Meet you in the next video. Thank you.